This lecture is about identifying causes of muscle overactivity in the upper limb after stroke and strategies to help stroke survivors decrease overactivity in their upper limb muscles after stroke. So we'll think very much about the analysis of the causes of muscle overactivity so that we're targeting what's causing the overactivity, and we'll go through a list of principles or strategies for helping reduce that overactivity. So as a summary of the causes, what we often see as overactivity can be compensatory movements for the impairments that people have, for loss of strength or contracture, for example. It can be that people use some muscles excessively because of lack of coordination or skill in what they're doing, because of decreased sensation and because of spasticity. So we're going to work through those causes and look at some examples of each one and look at strategies for helping to decrease muscle overactivity in the presence of those causes of overactivity. So starting with compensatory movements. So if we start with Tony here, you can see Tony is trying to achieve transport, pre-shaping, and grasp of that cup. And you can see quite a lot of compensatory movements there. So you can see he laterally flexes his trunk towards the left. He elevates his whole shoulder girdle. He abducts and internally rotates at the right shoulder. But if you think about what is causing those compensatory movements, you can see that with Tony, it's obviously that he has a very severe loss of strength in the muscles that he needs to be able to use to achieve those movements. So for Tony at the moment, trying to practice all of those components together of transport, pre-shaping, and grasp is much too much for him to practice, and it's going to lead to him having to use lots of compensatory movements because he can't use the muscles. He's got insufficient strength in the muscles that you would usually use to achieve those movements. So if we have a look at some strategies, then one strategy for, at least we're starting to see how much forward flexion he's got, is to take out the pre-shaping and grasp component. So here he's now practicing, the cup is taped into his hand, so he doesn't have to try and do the pre-shaping and grasp component. But you can see that's actually a very good visual cue for him, is trying to keep the cup upright, to put it onto the table, and that'll help to try and maintain external rotation at his shoulder. You can see that the table is still too high, so he's still having to use some compensatory movements. So really this practice still needs to be modified in some ways to decrease the force requirements. So the components have been sort of separated out for him to allow him some practice, but it still needs to be adapted more around the level of strength that he's got. You can see he's got some shoulder forward flexion, but not enough to be able to get the cup onto the table there. And so he still has some compensatory abduction and internal rotation. If we now have a look now, what's happening here is that in the next video is that the transport component has been taken out, and he's practicing pre-shaping and grasp of the cup. But you can see here that he's lacking thumb abduction as well as MCP extension and wrist extension. So in fact, he actually then starts to get some abduction and internal rotation at his shoulder in an attempt to try and get the aperture of his hand towards the cup. So you can see here he starts to abduct and internally rotate. So again, that component is really probably too difficult for him to practice at the moment, and he needs lots of strengthening of thumb abduction, strengthening of wrist extension, strengthening of his MCP extension as well too. So if we move to the next video, this is somebody who's got a lot more strength in their arm, but you can see that that Rob here, is trying to cut the putty. You can see there's quite a lot of force going through his index finger. You can see that he actually can't really stabilize the knife well into the palm of his hand. And he's getting quite a lot of compensatory abduction and internal rotation at his shoulder because he can't stabilize the knife well in his hand. And he's getting a lot of excessive force with his eyepiece flexed through his index finger. But that's not really working very well to push down onto the knife because he sort of can't really coordinate that force down through his index finger well, but he is actually pushing quite hard with his eyepiece flexed. So if you think about what needs to happen with Rob, what he's being asked to do is much too difficult. So to cut putty requires quite a lot of force. So one thing I think that Carl and Annie would certainly agree with this is that we should chuck out all putty in the context of practicing cutlery or practicing cutting with a knife, because it's generally much too hard and much harder than the sort of demands of normal cutlery use. And what it's resulting in here is a whole lot of excessive muscle activity for Rob, rather than him practicing the things he really needs to practice, which is being able to stabilize the knife in his hand better, being able to get some force in a coordinated way down through his index finger with his eyepiece staying in extension. And if he could start to do those things better, in a position of wrist flexion, then he wouldn't need to use so much compensatory shoulder movement. So here you see somebody practicing cutlery with something that's a much more normal thing to try and cut. So chuck out your putty, get bread or whatever is the sort of thing that replicates more a kind of normal food kind of texture. But here what you can see with this person is again quite a lot of excessive force going down through their index finger. And again, they're unable to stabilize the fork well into the palm of their hand. And you can see from the position of the forearm there that they're actually using quite a lot of abduction and internal rotation. So again, they probably need to practice those components of being able to stabilize the fork better in their hand, and then they wouldn't have so much excessive force coming down through their index finger. So the summary of what we've seen there for some strategies to decrease compensatory movements is to decrease the level of difficulty of the task, because the Tony being asked to do all of those components at once, it's too hard. Rob being asked to cut into putty, it's too hard because they don't have sufficient strength in the critical muscles needed. But also in terms of task specificity, chuck out the putty anyway and practice something that's more like normal food. So that's another strategy. Break things down into part practice. So what we see with Tony, practice the transport component. When he's ready, practice the pre-shaping and grasp component without combining the whole lot together, so that that will lead to less compensatory movements and less excessive muscle activity in muscles that shouldn't really be working so hard for that activity. Decrease the force requirements. So again, when we saw Tony transporting his arm forward, just practicing the transport requirement, he still had some compensatory movements because he was being asked to reach higher than what he could manage to reach with his lack of strength at the shoulder. So decrease the force requirements so that somebody can achieve the task without so much excessive muscle activity that ends up being sort of compensatory movements. Decrease the degrees of freedom. So take out some of the components and make it just one or two components of the movement rather than all components at the same time. What we're looking at again here is compensatory movements, but in somebody who you can see has got very limited active range of external rotation at her shoulder. So when we see her reaching for the cup here, she uses her trunk a lot to transport her arm forward. Okay, so you can see now she's been set up in a way that gives her feedback about her trunk movement. So she's sitting on a chair with a backrest, and she's practicing within the range that she can manage to do without the compensatory movements. You can see that she's still limited by her loss of external rotation, but she's using forward flexion with as much external rotation as she's got to transport her arm forward. And again, she's just practicing that component of transport with the cup, just staying in her hand. And then what we see her practicing here is just really practicing moving to the end of range of her external rotation. So you can see this is a good training strategy for anybody who's got weakness in their external rotation, so that they're practicing moving to their end of their active range. Also a very good strategy for anybody who's got contracture of their internal rotators, so that they're actively moving to the end of their passive range, and then you would be hoping that then increases their passive range from that a lot of practice where they're moving to the end of their available passive range, and doing that repetitively. So here, thinking about compensatory movements again due to weakness, but also that could be due to somebody who's got loss of passive range of movement, and it's about doing a lot of practice at the end of range of their active movement. We're now thinking about excessive muscle activity in the context of skill acquisition. We're really thinking about it's, this here that you've got Melanie's got sufficient strength in her upper limb to pick up the cup, but she's hasn't got good coordination of the muscles needed for particularly for her pre-shaping and grasp of the cup, and then she uses excessive muscle activity around her shoulder. So I'll play this video and you can think about the conversation that Carl is having with Melanie and the strategies that he's using to help her identify what is the amount of force requirement that is needed to pick up this cup. And then she can start to think about really trying to modulate better the amount of force that she's using.
Part of the problem in terms of picking it up is that you're actually using the muscles too much. You're getting it to your mouth, but I think the muscles around your shoulder are working too hard.
Yeah.
And this, in reality, is very light. It doesn't add much weight to your arm. So if you pick it up with your left hand, how heavy is that?
It's really light. Yeah.
And you can see how smooth that left arm is in terms of picking it up.
Yep.
Muscles work smoothly. So have a go with your right hand. Don't worry about taking it up to your mouth to begin with.
Okay.
But have a go at, first of all, remembering this is very light. And I'm going to pick it up very gently and put it back on the table without my arm shaking. So there's no need for your shoulder to help at all.
So it's only the bottom half from the elbow down.
Yep. Gently up. Well done. Now can you do 3 in a row without your arm shaking? See how you go.
Okay.
Okay, what about that 3?
The first one was good. The second one wasn't as good, and the third one, my shoulder did start to join in a little bit.
Yeah. So what?
So you can see the strategies that Carl uses there to help Melanie identify the amount of force that's needed. Picking up the cup with her intact arm, you can see the words that he emphasizes, that it's light, be gentle. He simplifies the task, so rather than being shoulder and elbow moving together, she's practicing just the elbow flexion component, and she's lifting it just a short distance off the table, so that she can just take it down to an achievable level, but also not a lot of repetitions. And now we'll have a look at the next video where again they're kind of really trying to identify what's the number of repetitions that she can do without her shoulder starting to turn on excessively.
What happens when that starts to happen like that? What's going on in your shoulder, do you think?
Well, one, it's been used to just compensating, and I think I guess I'm getting a bit tired, and what just wants to join in to help bring it up.
Yeah. One of the things that we need to work out together is how many reps you can do before your shoulder starts to help too much.
Yeah.
Because if you practice and you start to practice the shaking, then that's what your brain is practicing. It's practicing shaking.
Yeah.
And that's not helpful.
No. Okay.
So see if you can do 3 again.
Okay.
And see how many out of the 3 you can do without shaking.
Okay.
Once again, keep in mind this is very light.
Yes.
Doesn't need a lot of strength. You can lift it gently and put it down gently.
Okay.
How about that 3?
I think that was a lot better than the previous 3. But I think the other thing that I was thinking about, apart from when my shoulder was deciding to jump in, is just breathing. Sometimes I find I hold my breath when I'm trying to do something really difficult, and that actually makes it worse. So just like breathing through it as well makes a difference.
Okay.
And also I wasn't clenching my left fist, because even though my shoulder compensates, sometimes my good side starts to compensate as well. Yeah.
It's really common that when we find something really hard,
Yeah.
that other muscles try to help. This is you don't have to have had a stroke for that to happen. It's perfectly normal.
Yeah.
So you can see that discussion there about, again, identifying how many reps Melanie can do. She's identifying strategies that she's aware of that help to decrease the muscle overactivity by breathing, thinking about what her intact side's doing, trying to relax her intact side as well. But also that conversation that Carl's having, which I think we need to be very aware of, is that using excessive muscle activity is a normal part of skill acquisition too. So when we try to do something that we can't do well and we're not very coordinated at doing, we will use excessive amounts of muscle activity. And one of the features of becoming more skilled with a movement is that we start to produce the same movement with less EMG activity in the muscles. So if you think about yourself picking up a new skill, so say if you don't know how to juggle and somebody was teaching you how to juggle, you can imagine you would be holding your arms very stiffly as you're trying to figure out how to do this skill. But as you get better and better at doing it, you would be doing it and your arms would be much more relaxed. You would be using much less muscle activity. So sometimes we see excessive muscle activity that is to some extent a normal part of skill acquisition, but also then exaggerated by the coordination problems that people have after stroke. So if we summarize the strategies that we saw Carl and Melanie using there, it's about identifying the muscle overactivity and having the conversation there, as Carl does with Melanie. Strategies, Melanie's already got strategies in place, having a discussion about those and thinking about the additional strategies that Carl identifies, about thinking about the weight, thinking about what her intact arm does, really decreasing the level of difficulty of what she's practicing, and identifying the number of repetitions done before a break. What we see in this video is Annie helping Nock to decrease the excessive muscle activity that he has that leads to sort of compensatory shoulder abduction while he's trying to practice his shoulder external rotation. And the way she is doing that is by alternating mental practice with physical practice.
Nha, do one mental practice and then one physical
Mình
practice
sẽ
to
làm
the
một
bottle.
lần nha, tưởng tượng là mình cử động và một lần mình làm thật ha.
Okay. Now do one from here out to here. Okay. Now rest your arm. Rest your arm and do a mental practice.
Rồi bây giờ mình nhắm mắt lại, mình tưởng tượng mà mình làm.
And now do another one of these. Good. Now rest your arm
Rồi nghỉ.
and do a mental
vai.
practice. Close your eyes.
Nhắm mắt lại.
And rehearse it.
Rồi tưởng tượng mình đang làm nha.
And so that's another strategy that you can use. There is, again, identifying the muscle overactivity and strategies that help with that, and where excessive force is being used, and allowing somebody to continue to practice with attention about that force production. And then we see, as we see here, alternating physical practice and mental practice. So sensory loss is another cause for excessive muscle activity. So if you have a look at this person trying to pick up the fork, and think about what you'd usually keep your MIPs a little bit flexed and use mostly movement at your MCP joints to come in and pick up an object like that. And there's a lot of excessive flexion at the IP joints and also at the MCP joints. And you can really see that against, the pressure of the fork against the index finger. And because of that inability to adapt the amount of force to what's needed to pick up the object, then this person's not able to hold the fork effectively. So really the key strategy here, again, is to adapt the practice. And so if you have a look at this person practicing now, so the task has been made easier by having the fork resting on some non-slip mat so that it's not sliding around as much. And they're not trying to pick up and manipulate the fork. They're just trying to pick it up, lift it off the table, put it back down again. But you can see now they're starting to get a much better position of their hand. You could do with still a little bit more flexion at the IP joints there to come in, but they're instead of the fork kind of twisting and moving around because of the excessive force, they're actually managing to successfully pick it up, put it back down. So the strategy really is to adapt the level of difficulty, give them something to practice. That's where they can actually achieve it. But also you can see the practice is also really giving them very good feedback. If the force is excessive, then the fork is going to twist around, and they're not going to maintain just that kind of that grip on it where they can just pick it up and put it back down again. And here you see them again in slow motion again here. So again, now we've got the fork on non-slip mat, but also some non-slip mat just to make it a little bit easier to grasp the fork. They're getting a little bit more flexion at their IP joints, but without it being really excessive amounts of flexion there. A little bit of rotation of the fork as they pick it up. So there's still some excessive force, but it's much better than it was with the adaptation of the task. So again, identifying muscle overactivity and identifying strategies, and the key one here being about making the task easier, actually decreasing the force coordination requirements by changing the task, or still doing a similar task, but not picking up to manipulate, but just picking up a small distance, having the non-slip mat to make it easier, and also the fact that that task provides feedback. So excessive force will lead to an ineffective grip of the fork. So it's a good strategy for practice too, because somebody can see immediately when they're applying too much force. And so in the presence of sensory loss, obviously that's going to be very useful practice for them. We're going to watch this video of Annie working with Jill, which you saw in week 2. And again, think about this in the context of communicating with somebody who's got spasticity, and thinking about what training strategies can you put
Bring
in.
the back of your wrist to touch the cup. Okay, good try, but getting further away now. Yeah.
Cool.
So what I'm seeing happening is that your shoulder can move your arm out to the side, but you've got lots of overactivity in your elbow flexors and your wrist and finger flexors. Okay. What strategies do you do to try and help reduce the amount of overactivity in your fingers and your wrist and your elbow?
Is that like spasticity?
What sort of things do you think to try and help change the way those muscles work? Do you have any influence over them?
Not really. Still no.
Okay.
So unlike Melanie, Jill doesn't have any specific strategies to decrease that, and she does have spasticity in her arm. She actually does have Botox injections, because you can see she's got a hand where her fingers become so flexed that it starts to interfere with hygiene and dressing. So, which is really one of the key indications for having Botox. But if we have a look at what she practiced then, which is what you saw in weeks 2 and 3, was using mirror therapy and using electrical stim. So again, despite the presence of spasticity, it's still all about trying to find active muscle activity that she can switch on voluntarily. And so they were able to set up some successful electrical stim and to show her how to do the mirror therapy that she can continue with at home. And when I visited her a couple of weeks after that initial assessment at home, we were then able to continue and to explore for muscle activity. And in fact, she does have some voluntary activity in her triceps. So you can see with the task being set up to make it as easy as possible. So having some height to her elbow so that her forearm's not dragging across the table, and something slippery, which is a serviette or placemat or something. See, it's a bit exciting because she hasn't known that she could move her arm that much voluntarily before this. But you can see that she still has that really, that spasticity in her finger flexors. They're still quite tightly curled up, but they're not particularly getting worse as she practices. And really what this is allowing her to do is to do some voluntary practice with some muscle activity that she can activate voluntarily. But you can see with a setup that is making that movement as easy as possible. But this is all at home, so this is stuff that she can continue to do on her own at home. And she also has a very small amount of shoulder flexion here too. And you can see what's important here is to really, if we don't set the targets up well, she'll be then starting to use a lot of other muscle activity to get to the marker, because it's really only a very small amount of forward flexion that she's got. So she's really just trying to get the wheels just across the black tape marker on the table. And you can see her finger flexors are actually staying out in some extension here. So she's managing to do that actually without switching on other muscles excessively. So I think really still our main goal, despite the presence of spasticity, is to, again, to see if that person has strategies that help them decrease that muscle overactivity, but to still to identify and explore and persist and look for muscle activity that is voluntary muscle activity, and find ways that you can set up practice that so that people can do practice with their voluntary muscle activity, which takes us back to all those strategies that we've been looking at in week 3 about increasing strength in very weak muscles. Again, as in for somebody like Jill, Botox is effective when you've got somebody whose hand will become so tightly curled up that it's going to be a problem for hygiene and dressing and things. So Botox is useful for her, but obviously it doesn't change the function of her hand, though. So it's really still about exploring active muscle activity. So the take-home messages of all of that is that what we still need to prioritize is looking for strength, looking for some voluntary muscle activity in very weak muscles, using all the other strategies that were discussed in week 3, mirror therapy, mental practice, electrical stim, as Jill does in her home practice, finding ways that she can do some repetitive practice to achieve some neural plasticity and increase strength in those muscles. And, we're bringing the focus on the things that can change. We can change strength and coordination, and changing spasticity. It doesn't change somebody's function, though when it's problematic in this kind of context, then it will change things like that, hygiene, pain, the ability to clean and get dressed more easily. You can see those conversations that were had with Melanie and Jill about trying to identify strategies that help them to decrease muscle activity. And then the other really key strategy that we saw was really adapting people's practice to the right level of difficulty. And that's what we're skilled at doing as therapists, but we always need to persist in is making sure that we're not setting up practice that actually is encouraging excessive muscle activity because the practice is actually too hard for them to do. Anyway, so I hope that's a helpful overview of strategies to decrease muscle overactivity in upper limb muscles after stroke.